There's a lot of crazy signs out there about healthcare reform. Some are crazy because they are the truth, and America still has not reformed our current healthcare system, while others are crazy because they are downright lies. However, how does one sort through all of this information to uncover the true story about our broken healthcare system? This is a perfect example of a downright lie. The government has no interest in getting into your doctor's office. They actually want to get rid of the people who are in there who shouldn't be, also known as the insurance company. This way, the doctor will be able to do their job more efficiently. Now this one is a great example of a factual claim. This is true. Premiums have been growing in America since 2001. Premiums for single people rose from $2,500 to $4,900, while family coverage increased from $7,000 to $13,000. This is an outrageous increase, and something must be done. Here is an issue which many people have been confused about. This statement is very misleading because under President Obama's plan, you are allowed to keep the insurance plan you have along with all of your benefits. This person is confused. The government would like to set up a group of private insurers and one government plan in a healthcare exchange where those who do not have health insurance can shop for it. The government will set up rules for insurers that decide to participate, such as eliminating pre-existing conditions and offering minimum coverage. This statement is shockingly true. In September, a Harvard Medical School study revealed that nearly 45,000 people died in America in 2005 due to lack of health insurance. Yes, that is more than homicides and drunk driving accidents combined. This number is so incredibly high that it should be a crime for our senators and congressmen to ignore it. President Obama's plan will drive these numbers down by creating available and affordable health care coverage to anyone who seeks it. This is another downright lie. The Congressional Budget Office found that the proposed Baucus bill will not only be deficit neutral, but it will reduce the deficit by $80 billion in the next 9 years. Here's a clip in which Obama puts down claims like these.
I will not sign a plan that adds one dime to our deficits, either now or in the future. We've estimated that most of this plan can be paid for by finding savings within the existing healthcare system, a system that is currently full of waste and abuse. The only thing this plan would eliminate is the hundreds of billions of dollars in waste and fraud, as well as unwarranted subsidies in Medicare that go to insurance companies. And we will also create an independent commission of doctors and medical experts charged with identifying more waste in the years ahead.
This claim sounds so insane, but what is more insane is that it is true and allowed to occur in America. Yes, it is legal in 8 states and the District of Columbia to deny coverage to someone because they've been a victim of domestic abuse. The Women's Law Project spoke how in 1994, a Pennsylvania woman was denied health insurance because she was a victim of domestic violence. Since then, many states have changed laws, yet 8 states still allow this to continue. This sign is true and is a big reason as to why the insurance companies are making so much money off of us. Many feel that the profit is not something that should be associated with health, sickness, and suffering. There are incentives to deny claims because the insurance company receives more money, and there are often so many loopholes that it is so hard for working citizens to keep up with the rules. This opens a large debate on whether or not profit altogether should be removed from the case of health insurance. Another huge debate has been over the fact that illegal immigrants will benefit from all of this reform, while putting the burden on American taxpayers. The House bill states that those not legally present in the United States will not be able to receive subsidies for health insurance. If illegal immigrants want health insurance, they will have to pay for it on their own backs, not on those of the American citizens. So this statement is false. One of the most interesting facts I have seen has been this. After you hear all the screams of how other countries have socialized medicine and we are evil if we resort to that, we look at our ranking and we see that we are 37th in the world, behind so many of those countries that some American citizens scream thoughtless and unsubstantiated claims that. The World Health Organization ranks America's healthcare system as 37th in the world. It is time to lower that number to reflect the change that we Americans really want to see in our healthcare system. When you take away all the lies, misinformation, rumors, and nonsense, there is no argument against healthcare reform.
Time for bickering is over. The time for games has passed. Now is the season for action. Now is when we must bring the best ideas of both parties together and show the American people that we can still do what we were sent here to do. Now is the time to deliver on health care.